and I was like, oh no. All right, so our strategic community grants program is our biggest grant area. It funds programs in the community. One of the, I guess, pools within that are the strategic priorities grant program. So that includes our health, education, and financial stability programs. That is really the chunk of what we're going to be talking about today, because most of your work falls within one of those pools. And that's really where the major changes were made to the application or the impact agenda this year. Alongside that, we also have our basic needs grant program and our healthy lifestyles coalition grant program. So our basic needs grant program funds programs that address the immediate needs of residents that include food, shelter, safety. This hasn't changed much over the last year. The one thing that we are asking of our basic needs partners this year is we want to see that your program is providing strong linkages to other supports that move residents towards financial stability. So not only getting them in the door to give them food, shelter, safety, but making sure that they are then linked into other programs, which could be your own programs or programs at other organizations that are then making sure they're moving along that continuum. Healthy Lifestyles Coalition is a signature initiative of United Way of Broome County. This has been going on since 2012, and we really took over funding this in terms of the work being done out of the Lee Barta Community Center in 2017. So this is a health initiative that specifically targets the north and east sides of Binghamton. So if you are working specifically in that area, this may be a good option for you. That being said, no changes made to this year. So again, we are looking for programs that are advocating for the adoption of healthy lifestyle behaviors, the creation of structural supports, environmental changes, and/or policy initiatives, programs that support social, emotional, and mental health of all individuals, programs that increase access to and participation in physical activities for all individuals, and increase access to and consumption of healthy foods and beverages for all individuals. Again, our health priority touches on these strategies as well. But the real key to HLC is this is geographically specific. So in order to be, I guess, an appropriate applicant for this, you need to specifically be working in the north and east side of Binghamton. All right, and just a timeline before we start talking about some requirements for the grants. As all of you know, our RFP released last Friday, November 3rd. Today, we're hosting one of our mandatory information sessions. So congrats, because you've done the first thing you need to do in order to apply for this grant. So if you do nothing else productive today, this was productive. The LOIs are due on December 1st by 3 p.m. Tim will talk about this a little more when we get towards the end of the presentation, but our LOI process is going to be a little bit different this year in that in years past, you've been given access to the application pretty immediately. This year, there's going to be a little bit of a lag. However, you do have access to the content of the application and the RFP, so we would encourage you while you're waiting for access to start gathering the information you need and writing that application. We'll be hosting office hours on December 14th, so if you have any specific questions related specifically to your grants, your application, that's a great time to ask them. Applications are due January 26th by 3 p.m. And then we've got a little bit of lag. For those who are not familiar with our process, we convene our volunteer impact councils between February and April to make funding decisions. So it takes a little bit of time to get to May, when we will be notifying all of you of the decisions. Either way, if you're funded or if you're not funded, you will hear from us. During that time frame, you may be contacted for additional information. So if you're somebody who doesn't check your email often, I would make sure you're checking it at least once a week during that time frame in case we reach out with some other questions. And then finally, if you are selected to be funded, the deadline for funding contracts is June. So then we're working to get paperwork out to you. You're getting that paperwork back to us, and then we're able to start funding you July 1st. So some application requirements. The big one in terms of eligibility is you must be a not-for-profit tax-exempt organization, a 501c3. Question we have gotten in the last couple of years are about fiscal sponsorship if you are an organization that is not a formal 501c3 yet. we will not be able to directly fund you. However, if you are interested in subcontracting with a 501c3, that's something that you are able to set up on your end. However, we can't set that up for you. So again, if you're not a 501c3, there are some ways that you can find ways to benefit from this funding, but we cannot directly fund you. The other eligibility requirements kind of fall under that 501c3 umbrella. So if you are in good standing with the IRS and in good standing with the state of New York, you're probably hitting most of these points. So again, abiding by federal and state laws regarding non-discrimination, having an active volunteer board of directors, having an admin structure that has defined roles, mission statement, bylaws, being financially stable, performing a budgeting process, having current license certification permits, etc. Letter of intent, again, that is due Friday, December 1st. A little bit different information that we're asking for this year, but it remains largely the same. You do not need to know every single detail of your application in order to submit your LOI. If anything changes from the LOI to the application, that is also totally okay. Just give us a heads up. But if it's not, again, if you ask for a certain amount of money in the LOI and then you start writing the application and realize that that ask needs to be different, that's okay. Just give us a heads up that you're making that change intentionally. Information that we're looking for is contact information of if we have questions about the grant, who is the person we should be interfacing with. Organizational information, so we'll be asking for, again, your mailing address, your address, the executive director. We've also added some equity information this year. This is not qualifying or disqualifying information. This is part of our new strategic plan, is that we want to make sure that we're funding a diversity of organizations and a diversity of size organizations. So this information just lets us know kind of where your organization is falling into that, so we can report out that data piece as we move forward to our board of directors. Also need some details about your program, although not a ton of details. So we need, again, a paragraph or two describing the program, how much funding that you are requesting from us, as well as the total program budget for that time frame that we're funding. Again, that can change between the LOI and the application. Just give us a heads up. We want to know the target area and population and the number of clients to be served by the program. And finally, asking you to define what priority area you fall into. You're really going to want to base this off of the long-term outcomes and strategies this year. And we'll talk a little bit more about that in a moment or two. And then finally, we have some questions for additional information. This relates to some specific funding initiatives that we do on our end in order to bolster our community campaign. And basically, we can use this to decide whether or not you would be eligible for receiving funding through that stream. This is not additional funding. It essentially just lets us say, okay, if we are fundraising to address food insecurity, we know who our food insecurity partners are, because you told us whether or not you are working to combat food insecurity here. Multi-year funding. So last year we did not offer multi-year funding because we knew that we were going to be making some changes to our impact agenda. But this year, since we've made those changes, we are offering multi-year funding again. To be eligible for this, you must include 2 years of your program's budget within the program budget attachment. You must have strong intermediate outcomes and measurement details. So being clear about, like, what are you achieving year one? What are you achieving year two? And then also you must meet ongoing reporting requirements in terms of the contract. Multi-year funding is approved on a program by program basis, meaning we can look at your application, or the impact councils can look at your application, and they can say, okay, not a great fit for multi-year funding, but we do still want to fund them for 24-25. So you would be getting a 1-year grant, even if you ask for multi-year funding. It does not mean you can't reapply for funding in 25-26. You're just not automatically approved for it. Additionally, since it's program by program, you could be approved for multi-year funding for one of the programs you apply for, but not for another program you apply for. Being approved for multi-year funding. So Unfortunately, this does not guarantee you a specific funding amount. So if year one, you receive a $30,000 grant from us, year two, our impact councils essentially look at that funding again and make funding determinations based off of the community campaign, so how much funding they actually have to give out that year, the program's performance for that first year of funding, as well as community needs. So if we see needs shift and they need to shift resources from this program to another program, again, that funding could go up or down depending on where you're falling. However, the real perk of multi-year funding is that it takes a little bit of the administrative burden off of your team. So you get to retain your score from the 24-25 application year and carry that into the 25-26 cycle. What that means is you do not submit a full application for 25-26, but you get access to a supplemental application that's about, I think, 5 or 6 questions long instead of, I think, 17 for our full application. So again, it really is just an opportunity for you to update us on any changes to year two, anything you want us to know about. So it keeps you from having to write this document all over again for 25-26, should you be awarded multi-year funding. All right, I'm going to drink a little bit of water because we're entering probably the longest section of the presentation. Now is a good time to remind folks that, again, if you've hopped in a little bit late, please make sure that you have put your name, your organization, and your email in chat. Make sure that's in one chat so it's all together. Just lets us know that you made it to the session and that you're here. Again, if you are driving or calling in and don't have access to your keyboard, just email us after the fact and that will suffice. But let's jump into our impact agenda update. So I know many of you are familiar with this language, but the way that all United Ways really envision themselves is as a vehicle for collective impact. So essentially, we want to make big systemic change in the community, and we understand and know that we cannot do that alone, and our partners can't do that alone either. We have to be working together in order to achieve that systemic change. And one of the things that we need in order to do that is a common agenda, which is a shared understanding of what the problem is and a shared vision for how we are going to change that problem. So why change anything? Because I know change is a 4-letter word for us, especially the last couple of years, because there's been so much change. We have to update our impact agenda. And one of the reasons why is that the challenges our community face are constantly evolving. And also our understanding of those challenges and the tools we have to address those challenges are also evolving. So we want to make sure that the way that we are articulating the work that we're aspiring to do is based off of the best available information to us now. Another factor that many of you are also aware of is that we have had a downward trend with our annual community campaign. We want to keep funding organizations just like yours who are doing incredible, important, needed work in our community. But in order to do that, we have to be really, really clear about why United Way exists in Broome County and why it's a worthy investment for funders. We also want to make sure that we're keeping philanthropic dollars in Broome County. So we want to make sure that people understand why investing in Broome County, whether that's through United Way or designating it out to one of our partners, is the best bang for their buck in terms of making real change in their community. Finally, and I would say most important to me, is that we are really serious about creating lasting systemic change in our community. I know many of you feel the same thing, and that if we were not working in nonprofits, we would be doing something else. And the only reason that we're here is because we care deeply about what life is like for the people around us. So our new impact agenda is really laser focusing us on terms of how are we actually going to achieve the condition in our community that we desire. So how did we start this process? Back about a year ago, we kicked off our latest community conversation series, where we sat down with community members and really asked them about what their vision was for the community, what some of the challenges were, and what were the things that made them hopeful for the future. We had many wonderful facilitators. Many of you who are probably from these organizations are represented in the room today, so thank you for being so generous with your time. We also had many wonderful note takers who are making sure that we are capturing every single word that was said at those tables. In total, we met with 134 community members in person across Broome County. And then we also sent out an online community survey, and we had another 124 residents respond to that as well. So we took all of that information and all of that feedback, and we incorporated that into our results-based accountability framework. So put a pin in community conversations, because we'll be getting back to that in just a second. RBA is something I think I've talked endlessly about for probably the last year and a half. So many of you are familiar with it, but for those who don't, we're just going to give you a little crash course. So RBA is a disciplined way of thinking and acting to improve entrenched and complex social problems. So it moves you quickly from talk to action, and you work backwards towards means. So you start with ends, with the vision for the community, and then you have a conversation to really define what are the specific things that you can do to achieve that end. It also is very data driven, and data is used on two levels. So the first level is I would say the level that all of you are familiar with if you have been funded by United Way in the past, is we want to know what your program level data is. But this other piece with RBA is about population level data. So really looking at the systems in which we are working and seeing if the conditions that our community is facing is getting better for all people, or if it's getting worse or staying the same. And that is really how we judge the success of a collective impact initiative. So something you will be sick of seeing by the end of this presentation, you'll probably see it in your dreams tonight, is this graph. So this is the turning the curve graph. And essentially, again, we pick an indicator that is a stand-in for the condition we want to achieve in the community. We graph that out historically over time to say, okay, how have we been doing? And also based on that trend line, how would we be doing in 10 years if everything remains the same and we're moving in the same direction? We then have that conversation of, okay, if that condition 10 years from now is unacceptable, what are some of the things that we're going to be doing differently as we move forward that we think have a good chance of influencing that trend? So this conversation is through the turn the curve exercise, where essentially we ask a series of 6 questions. First is, what is the end? What is that vision we're hoping to achieve? Next is, how are we doing? Again, we're picking indicators that are that stand-in for that big vision statement. We're then asking, what is the story behind the curve of the baseline? So we're seeing trends in the community. Why are we seeing those trends? Who are the partners who have a role to play in turning the curve, making sure the right folks are at the table who can actually address those challenges? What works to turn the curve? So what are the best practices that we've seen implemented in our own community and also other communities? And what are some of those emerging innovative practices that we think have a good chance of working as well? And then finally, of all of those options, what are the things that we are specifically doing or proposing to do to turn the curve? So a little bit of common language before we really get into what implementing this over the last couple of months has looked like. Our vision statement for each priority, that is essentially what we're aspiring to achieve in relation to that priority area. You're also going to see long-term outcomes within each of those priorities that were determined based off of the specific indicators that were selected as a stand-in for that vision statement. This will allow us to measure the systemic impact of our investments as we move forward. Finally, you're also going to see high priority groups. These are groups that we have data to suggest that they are more likely to experience poor outcomes on these long-term indicators, or these long-term outcomes. So therefore, they should be the priority as we look to make interventions in the community. In order to make interventions, we've identified some key strategies. So these are the kind of programs that we want to fund to address those long-term outcomes. Ideally, it would be great if those strategies address the high priority groups, because again, we've got data to suggest they are the most in need. In order to measure your progress within your program, you'll be looking at a quantity measure. So that will tell us how many people are served, and you'll be looking at a results indicator. And that tells us, of the people served, what percentage of them achieved a certain outcome. Tim will be talking about this more in his section, but the reason I wanted to shout it out here is because I wanted to be really clear that you're not responsible for tracking the long-term outcomes. If you can within your client base, that would be great. but we are not expecting you to do that. You are only responsible for tracking your quantity measures and your results indicators. All right, so implementing results-based accountability. Again, I told you we'd get back to the community conversations, and we surely are right now. We use that feedback to present out to our partners and begin to craft what a vision statement would look like within each of these priority areas. We also presented some of those potential indicators based off that draft vision statement of what would we use to measure if we achieved it. Our partners then suggested changes to the vision statements based off of feedback from the community conversations. They voted on the indicators they felt were the strongest of those that we selected, and they also presented some additional indicators for each of those priority areas as well. So then we went out, we did a lot of research, a lot of number crunching, and we presented the baseline data for those indicators that they selected in meeting 1. We projected the changes if nothing changed. So that's that turn the curve graph that you all saw. So we did that for each of those indicators. And then our community partners narrowed the list of indicators to 2 or 3 for each priority. They then helped us identify any stakeholders that they felt like we needed to talk to before we started to look at some of the root causes of those trends that we're seeing. Meeting 3, we came in with a lot of research in terms of, okay, if these are trends that not only our community is facing, but other communities are facing, what are experts saying are the reasons we're seeing those? What are people with lived experience saying the reason we're seeing that is? We also connected with a lot of stakeholders in our community and got their expertise and feedback as to why we were facing these specific challenges. And then our partners were great in giving us feedback as to what was and wasn't resonating as true based on that narrative, helping us surface assumptions as well in terms of things that we need to dig in a little more to really understand these challenges. And then meeting 4, we finalized our back map of indicators to really narrow in on root causes and begin to craft strategies that would address some of those causes. Our partners then provided feedback on those strategies in terms of feasibility, values, and leverage. I think we left out specificity because I knew we couldn't get too specific. And then we've used that to refine those strategies a little bit more and make some language updates as requested by our partners. So what does this all look like now? I am going to breeze through this a little bit because I know it's a lot of content and we want to make sure that we all have time to really get into the meat of the grant application. However, we will be sending everyone a copy of this. And what we really wanted to make sure was you had this data available to you as you start writing the application. So for health, our partners updated our vision statement to say, Broome County is an equitable, engaged, and empowered community that fosters healthy environments, healthy relationships, and healthy people through affordable and accessible support. So again, we've got that vision statement, and how will we know if we achieved it? What are those things that we're measuring? So we're looking to reduce the rate of potentially preventable hospitalizations, reduce the percentage of adults reporting 14 or more days of poor mental health per month, and reduce the rate of indicated reports of child abuse. As I said before, we have mapped out the trends for these 3 key indicators within each priority. So we have that data available to you all to look at. We also have data mostly on the state level as to what groups of people are doing better on this and what groups of people are doing worse on this. So that is the information that we used in order to craft, essentially identify who our high priority groups are. So again, based off of this data, we know that likely within our community, seniors, Black non-Hispanic residents, and residents from low-income zip codes are likely to have a more inflated rate of potentially preventable hospitalization. So if we are targeting a specific group for our intervention, we want to make sure that we are specifically making sure those groups are included and addressed. We also, again, have the back maps for each, which kind of will help feed into why we picked the specific strategies that we did. I'm not going to dive too much into this because, again, we could be here for 3 hours, but this information is available for you to read through when you get a copy of the slideshow. We are probably not at the exact root cause of all of these issues. And the reason for that is a lot of the root causes have to do with policies that inevitably and hopefully will end up being changed in order to create more equity in our community. It's a little bit outside of the scope of this grant funding pool specifically. However, those are initiatives and things that we are interested in addressing in other ways, and there will be more to come on that. Again, for poor mental health, we've got that data on the state level that shows us who our high priority areas are in terms of who is doing better, who is doing worse. So based on that, we want to make sure that we are looking to specifically support residents who have a disability, residents with household income below $25,000 annually, as well as residents who have experienced 2 or more ACEs. This idea of addressing ACEs specifically came from conversations with some of our community experts, who again, when we start digging into the root causes, says that a lot of poor mental health kind of goes back to possibly unaddressed trauma earlier in life. So folks who have experienced 2 or more ACEs are more at risk for poor mental health. Again, we've got that back map for y'all to read through. Then our final indicator for health is reported abuse or maltreatment rate per 1,000 children. This one is a little shocking to look at because our rate is 3 times the New York State rate for the same period. So our partners saw this and we knew this was something that we definitely wanted to hone in on and address. So our high priority groups are low income families, BIPOC families, and families with adults who have experienced 2 or more ACEs. And then this really gets at like how we've been able to determine who is and is not more at risk. A lot of this is like systemic factors. A lot of this has to do with some discrimination in our community that really brings us back to those high priority groups. So in order to address the causes within all of those back maps, the key strategies within health are now to increase access to healthcare and mental health resources by removing barriers to access, such as affordability, availability, and understanding. Increase the community's knowledge of available resources and ability to navigate existing health and social service systems. Encourage healthy lifestyles through access to nutritious food and opportunities to exercise. Create opportunities to foster social connectedness and build social capital. And provide caretakers with resources to support positive parenting practices and alleviate the impact of poverty. All right, so moving on to education. Our updated vision statement is that together we can ensure all children and youth in Broome County have an equitable opportunity to do well in school, graduate on time, and succeed in a career by providing the support needed to achieve their full potential. The long-term outcomes, again, so how would we measure if we achieve that? We want to increase the percentage of children enrolled in early childcare, decrease the chronic absenteeism rate among elementary, middle, and high school students, and increase post-secondary preparedness by increasing post-secondary enrollment rate in college, as well as the percentage of each graduating class with a CDOS or CTE diploma. So we will start with childcare. I know that this is a wicked issue in our community, but looking to increase the percentage of children who are enrolled in childcare, with the understanding that a lot of that is driven by this graph right here in terms of the number of childcare spots in Broome County. High priority groups, families with infants and/or toddlers, obviously, because those are the folks that have the hardest time finding those childcare spots. Families living below the ALICE threshold. We will talk about that in a little bit, but essentially, these are families that we know cannot afford the cost of living in Broome County. And the rest of the high priority groups that you see are families who are more likely to be below that threshold. So that's families in a single-headed household, especially those with a female head, as well as BIPOC families. Wanted to pause here for a second because I know a lot of what is driving this trend, especially post-COVID, is the shortage of childcare workers. That is something we chatted about in our back map, and we are very, very aware of. And that is something that we are looking to address in our strategies as well. Chronic absenteeism. So this is another one of those indicators that is a little bit shocking to look at. This rate has increased since COVID. And based off of the data that we've seen, as well as conversation we've had with folks within the school system, these rates are not going down. So we also have good data in terms of what school districts have the highest rate of absenteeism. We also have data of who is typically chronically absent within each of those school systems. So trends we're seeing are students with disabilities, some of our racial minorities, as well as especially, I would say, economically disadvantaged students are even more at risk of being chronically absent. And we see this across school districts. Here's our secondary chronic absenteeism rate. Again, you'll see some school districts are doing better, some school districts are doing worse. But those similar trends, and that our BIPOC students are struggling with this, as well as students with disabilities, and being economically disadvantaged is also a huge piece of this. So again, high priority groups based off that information: economically disadvantaged students, BIPOC students, students with a caregiver who is a single parent and or under the age of 25. This goes back to that ALICE data, is that we know that they're more likely to be economically vulnerable than other groups. And then our back map. This really branches out into 3 different trees that really are I would say, the different paths for why a student might be chronically absent. So it could be lack of awareness, barriers in terms of like those financial barriers to actually being able to get to and attend school and be focused in school, as well as possible aversion. So students may not be engaged, they may be being bullied, things like that. All right, and our final indicator is another mishmash of 2 indicators. So we were really interested in looking at long-term outcomes for high school students within our county. So not just if our folks graduating, but are they being set up for success? And obviously college enrollment is a piece of that. However, definitely acknowledging that college is not necessarily for everyone, which is where those CDOS or CTE diplomas come into play. And that, again, if we know that students are getting some type of career readiness prep, that may set them up for success as well. Again, post-secondary enrollment in terms of who is going to college after high school varies pretty differently between school districts. Again, we just pulled data for Binghamton as an example, but you can kind of see what demographic groups typically do better and typically do worse on this. This trend continues, even for school districts that are maybe not as economically disadvantaged as the city of Binghamton. So here's Vestal, for example. Again, that data on the CDOS and CTE diplomas, we know that this over the last couple of years has been going up, which is good to see. We also know what groups are more likely to end up with that credential. So based off of that information, high priority groups in terms of interventions for making sure folks are going to college, or again, graduating with some kind of diploma that sets them up for a career, would be economically disadvantaged students, BIPOC students, and male students based off of the data available to us. Again, here is a little bit of a back map for maybe why a student may not have plans for post-graduation. Some of this could be barriers that they're facing. Some of this could be lack of planning, lack of information in terms of how you navigate those systems. We had a good conversation about how the CTE and CDOS diploma is like an opt-in track. So unless you are really being conscious about what you want to do with the future and you're made aware of these options, you may not know until you're graduating and that ship has kind of passed you. So after looking at all of those back maps, our strategies to address our education priority are now create resources for families that help reduce the cost of childcare, increase the number of childcare slots, create structural support for childcare centers, especially those that assist in employee recruitment and retention. Again, we know this is a big challenge right now. Increase engagement of caregivers in their child's education, reduce the influence of barriers that keep students from attending school, especially those stemming from symptoms of poverty, get students excited about learning by providing needed academic support and opportunities for enrichment, and by fostering a safe environment at school. And then this one's going to be blocked by my bar at the bottom, but it says increase the preparedness of students for life post-graduation by engaging in, Tim, can you read that last line for me?
Yeah, by engaging in planning, career education, and skills development.
Thank you. All right, our final priority, financial stability. So the updated vision for this is that when empowered through equitable opportunities, all Broome County families can have the earnings, income, and assets to be financially stable and work towards economic mobility and self-sufficiency. Our long-term outcomes, so again, how would we know if we achieve that vision? We want to reduce the percentage of the population living below the ALICE threshold, reduce the percentage of renter-occupied units in which gross rent is 30% or more of household income, as well as reduce the percentage of the population who lacks adequate access to food. So we'll talk quickly about ALICE. ALICE is a United Way acronym that stands for Asset Limited, Income Constrained, Employed. So we have our federal poverty rate, which basically says, okay, if you make below this income threshold based on the number of people in your house, you're living below the poverty line. And then there's everyone else. And if you're not below that line, you should be fine. And as all of you know, that is not the case. So ALICE is more inclusive in that it specifically looks at the cost of living in Broome County and says, okay, this is what it costs to pay for rent, childcare, transportation, food, clothes, a basic cell phone plan, those things that we know modern families need to survive, and who in the county is actually making more than this within their households, and who in the county is actually making less than this. So again, our ALICE threshold or our ALICE rate is always going to be greater than our poverty rate because it includes all of those folks who are making less than that survival household income level. The United for ALICE website has, again, that breakdown of what those costs should be and how it's calculated for Broome County. Feedback we've gotten on this is that this is low. So for example, $478 for a single adult to rent in our community. I know that is not realistic. So again, I would say if anything, our ALICE rate is probably higher than it's actually calculated to be. But again, it's still giving us better information than just the federal poverty rate in our community. The ALICE website also has great information in terms of what groups are more likely to be living below that ALICE threshold, so making less than they need to survive within their household. Again, we've got that by families with children and their household composition, whether it's one parent, two parents, what the gender of that parent is, households by age, who's more at risk, race and ethnicity data. And that really informs our high priority groups for this. So we're looking to specifically intervene with single-headed households with children, young adults that are younger than 25, seniors that are over 65, as well as BIPOC residents based on that data. Again, here is our back map, kind of sorting out some of those reasons why a household may be making less than that, which then informs our strategies that we'll talk about in a couple minutes. So our second indicator for financial stability is reducing the percent of renter-occupied units in which gross rent is 30% or more of household income. So this is really that affordable housing measure. We have data for New York State, which really tells us who is more likely to be encountering housing burden, with that being defined as paying more than 30% of their income on rent. So this is by ethnicity. This is by, I think this is income level, right, Tim? Sorry, my bottom bar is blocked again.
This is, well, individuals in poverty. I don't know if your bar is also blocked for me too, but
Hold on. Let me make sure I can actually read what that says. Oh, yep. So again, that is what percentage of the poverty rate they're living within, which again, makes sense that the less money you make, the more of that money would end up going towards rent, because again, we don't really have rent control in our community. But again, based on that information, that's how we determined our high priority groups. So women, especially those with children, are at risk for rental burden, as well as BIPOC residents, and of course, residents living below the ALICE threshold, because we know they make less money than what it takes to survive in Broome County. Again, here is our back map. We kind of reference out to our Alice back map because obviously if somebody is low income, they're having this specific set of experiences that kind of speaks across these different back maps, and we didn't want to put that in over and over again. And then finally, food insecurity rate. We've got this broken out for Broome County by race and ethnicity from Feeding America. We've also got this broken out for children. So based on that information, again, we can make some assumptions as to who the high priority groups are in our community for those interventions. So that would be low income families, families with children, especially single-headed households. Again, if we know that children are facing food insecurities, it follows suit that families with children are facing food insecurity, especially because parents will often shield their children from not having enough to eat by eating less themselves. And finally, BIPOC residents, again, based on that data from Feeding America. Here is our back map. Again, once again, referencing out to that Alice back map that we presented at the beginning of the financial stability section. So make sure you're checking that out as well. And then finally, that arrives us at our 4 financial stability strategies. So our key strategies are to increase residents' earning potential by removing barriers to employment and providing opportunities for advancement, increasing access to resources and services that allow families to build wealth, including homeownership, and increasing the number of affordable housing units in Broome County, as well as increasing access to benefits that decrease the cost of food and other essentials. Again, we've got our basic needs priority in here again, just as a reminder that, again, if you're falling more into basic needs, here's what you're addressing. And we also talked about HLC as well, and that this information did not change year over year. Again, we felt like it was really important to walk you all through that piece of kind of how the sausage got made this year, because even though a lot of the application itself is the same as years prior, the community need that we've identified and we've articulated with the help of you all is now a little bit different. So you want to make sure that you are writing the application to address that information, which again will kind of inform how you answer questions as we move forward. So with that, I will turn it over to Tim, so y'all don't have to hear me talk anymore.
Thank you, Lindsay. So just before we start going through the narrative section and some of the resources we have for you, just as a reminder, please put your name, organization, and email in chat. This is so I can send out the recording to everyone, and this is also so we can track that that you've attended one of the mandatory sessions. If in the next week you don't hear from me, then there's probably been some communication or I've mistyped something. So just reach out to me. My email you can find on our website. You can also find it on the RFP, which I'm just linking to in chat, So, please reach out. And just because I'm going through these questions right now, it doesn't mean that I'll never want to go through them again. So as you review, if you have a question, that maybe this doesn't make sense to you anymore, please feel free to send me an email. So moving to our next slide. So here's the rubric, and this is as we grade and go through the questions, they're given to a bunch of volunteers who we call our impact councils. And these impact councils will read through the 17 questions that are in the application and put, points by each one. And these are sort of how we evaluate each of these sections. You can also find this in the RFP. So here's some tips when working on the narrative section. First, read the RFP. I would just, highlight that only pages 10 to 13 of that request for proposal are the questions we have or things we need. Everything else is there to help guide you along and explain these questions and explain our process. Second, gather the information you need. It's always easier writing a grant when, you have that background to start putting it in to question and answer form. Make sure to be concise but thorough when answering each question. You need to answer each question to submit the application, and all these questions Lindsay and I and Paula look over every year and we think, wow, we'd love to make this shorter, and we will we will continue to do that, but as we try to figure out what we need in there, that's how these 17 questions are chosen. Write your proposal in a separate document and then paste it onto our website. So this is a little less important for the LOI you'll have to submit. However, when you write that big application, please write these questions on a Word document, a Google Doc, whatever you need to, so you have that backup copy. I know I've encountered issues before doing backend maintenance on our website, and I'd hate for you to encounter that same and lose your progress. And then remember that the people reading your application may not be familiar with your organization or program. So some of our programs and organizations we've worked with for many years, and some of the staff knows those programs really well. But remember, the staff aren't the ones grading. We have new Impact Council members who maybe are a little bit new to the area. Maybe they've worked in a very different sector, so they may not know your program like you do. So again, there's that thoroughness and explanation. So here's some resources, and when you get this slide, you'll have the ability to go to that Amazon book link. Grammarly is a fantastic writing assistance resource. I probably overuse Grammarly at this point, but it does help make your writing better and make you a better writer. There's the readability test, which Grammarly will also do, and that basically tells you what reading level you're writing at. In general, a lower reading level is better because it's easier to understand and can be more easily understood by everybody. Here's, GuideStar and Nonprofit Hub are some great blogs and websites. There's some great no-cost, low-cost sources, which are Nonprofit Ready and Candide. And then here's some books that we'd recommend. So let's get to the actual questions. Our first section of question is the program description. So here you can be awarded 10 points. So the first question simply reads, provide a brief summary of the program and project. So what we're looking for here is about 2 to 3 concise paragraphs, that are not assuming familiarity with the program. Again, the people reviewing this may have never heard of, I'm going to throw an organization under the bus, the YMCA. Maybe they've never heard of the YMCA before, they're unfamiliar. So do not assume familiarity when writing this description. 2, describe how the program helps to achieve at least one long-term outcome in your chosen strategic priority area. So here, this is these long-term outcomes that Lindsay has gone through and are in the RFP. So make sure you're addressing one of those. Demonstrate that you have familiarity with our priority areas and how this program falls underneath them and will lead to a long-term outcome change. Then 3, describe the specific activities that will be undertaken, including the number of people expected to be impacted, responsible staff, and the target date for completion. So address all portions of this question. You want to address all portions of every question, but especially number 3, because this is going to tell us who, what, where, when, why, and how well is it all thought out. And that's very important, especially as the reviewers are grading these questions.
Can I chime in really quick, Tim?
Yeah, of course.
Just wanted to shout out, especially for question 2, the county health rankings, what works for health tool. This is something we talked a little bit about if you were in our final RBA meetings, but essentially this is a compilation of all of the research that has done for almost every intervention on a social determinant of health that you can imagine. So again, we are not expecting you to have done the research on specifically why your program leads to X outcome, but there are folks who have done the research probably on a very, very similar program model. So that's definitely something you'll want to check out, and it'll help you inform how you address that second question.
Yeah, thank you, Lindsay. Yeah, county health rankings is something that not only do we use during this process and putting some of that data together, but when we write grants to other organizations for, some of our programs, like the Lee Barta Community Center, we're using county health rankings. So 4th question is going to be program need. This question is worth 15 points and is in the leverage category. So describe the need that the program is intended to address. Identify target populations experiencing disparities that will benefit from the program. Examples we give are students in color in a particular school or neighborhood, low income residents of color. please include local data to support your description of the need. So here you want to define that population using demographics and geographic location that you will be serving. So timely and relevant data, that's, generally the more specific, the better. So moving, away from countrywide, but to county, census tract, school district, that's much more helpful. And yeah, provide that data on a county level or lower. We know not all data you'll be able to find because we have spent the entire summer looking at data, but as specific as possible. So based on that data provided, you're answering, will your program serve the most in need of this service? So ideally, this will align with one of our high priority groups. We understand that programs can serve high priority groups and also other groups as well. And also, if your research has shown that there's a group that is in major need for this program and is comparable to the high priority groups we've listed, you can make that argument as well. So just because we didn't put it down doesn't mean there can't be other high priority groups. And we want to know, are there groups we're missing? Are there groups that are being served? The more information you can give there, the better. So here are some data sources. Just because these are the 4 sources we have up doesn't mean they're the only sources. So the New York State Department of Health, the US Census and American Community Surveys, County Health Rankings, and the ALICE report. Again, always make sure you're using the latest data version of the data. And again, you can use other data sources as well. I love the Federal Reserve of Economic Data. That's my favorite place to go, but that's just, where I learned about data first. So it has a special part in my heart. But, you can find data in other sources as well. So the next point is innovation. This is up to 5 points, and it's in the category of values. So do similar programs exist in Broome County? If so, how is your program unique or innovative in comparison? So this is, as we look at collaboration, we're trying to figure out how aware the program is of the landscape in Broome County for similar programs. And if they do exist, how does this program provide a niche, and why is it needed in relation? Or if another program doesn't exist, why is your program new or innovative? Or is it something about the challenges of having a program like your own? So just sort of explain that landscape. So now we move on to our impact section, which is under the leverage category. So this is up to 10 points, and that's comprised of 6 and 7. 6, describe how the proposed program will address persistent, historical, and significant disparities that exist by race, class, income, culture, or education. So here, we're looking to see, can you identify what caused the disparity and, that you're addressing with your program? And how does that disparity specifically impact the marginalized group that you're serving? Then for 7, will the program address the root causes of these disparities? If yes, describe how. So is this program treating the symptom of the problem or the problem itself? And we'll talk a bit more about root causes as we move on to the next slide. So, root causes, we have, the left and right of that picture is a healthy and an unhealthy tree, and you can see at the bottom, you have the roots. So on the left side, you have quality schools, access to healthy foods, etc. And above, you have decreases in violence, decreased smoking, decrease in stress, a lot of good things happening. Then on the right, you have your root causes of adverse living conditions, poor quality schools, occupational hazards, and you see those same issues are getting worse. So, we're curious about what those root causes are. And on the next slide, we talk about the 5 whys. So you've defined the problem, and then you ask, why is it happening? Why is that? Why is that? Why is that? Why is that? By the time you've asked that 5th why, you're probably at that root cause. We understand, and we are fully committed to supporting programs that are not addressing that root cause, because so often that root cause requires a level of advocacy work and greater collaboration that, not all programs are currently doing and can currently be doing. And we also recognize, if you're a program that's trying to feed people, people need food. Advocacy is great, people need food. So here we're just looking to see your understanding of the root causes, and how it relates out to the county. And, better off if you're addressing them. But again, we understand not all programs will. So next we move on to question 8. This is organizational capacity, and it is worth up to 9 points in the feasibility category. So what resources will the organization deploy in support of the program/project? So this could be staff time, facilities, board expertise, knowledge, program materials, etc. So here we're looking to see if the program's funded, does your organization have the resources and expertise to operate it successfully? And then also, are your staff, board, volunteers dedicated to this program? Our next question is past experience. This is also feasibility up to 8 points. So what experience does your organization, staff, and volunteers have in executing this or the similar program? Please provide data if available. So do you have a track record of success in executing this or a similar program is what we're looking for. And then if you're saying there's a track record of success, is there data and qualitative information that will support, you showing this record of success? So our next is collaboration. This is under the values category and up to 8 points. So are there other organizations that are critical to the success of the program? Please describe any relevant collaborative relationships that will contribute to program success. As anyone who's on our listserv know, we're constantly looking at ways to improve collaboration, and that's a big part of the work at United Way. So here we're looking for you to answer this question by explaining, are collaborative relationships coordinated? Are they ongoing? How are you collaborating in more than referrals? Because referrals are great, but where is that deeper collaboration occurring? So what are the roles of the collaborators? And are those roles clearly defined? And how is the responsibility for program success and client success, shared? So, collaboration we see as very important because it's one of the it's the third of 5 conditions for collective impact. So it's that mutually reinforcing activities. And on our next slide, we have a quote. Collective impact initiatives depend on a diverse group of stakeholders working together by encouraging each participant to undertake the specific set of activities at which it excels in a way that supports and is coordinated with the actions of others. Each stakeholder's efforts must fit into an overarching plan if their combined efforts are to succeed. There are multiple causes of social problems, and the components of their solutions are interdependent. So we cannot solve these greater wicked issues without this deeper collaboration. And that's, the purpose of our collaboration question, to find that out. So next we move on to sustainability. This is in the feasibility category and is up to 8 points. So will the program continue past the life of the grant? If so, what are the plans to sustain the program? So do you plan to reapply? Are you working to diversify funding streams through other funding sources? Is there anything about this model that makes it sustainable? Every year we work with a amount of funds that never matches the amount of asks we get. So these questions and knowing how we are supporting programs and how programs plan on existing without potential United Way support is very important. And 12 gets to that again, where if you received less funding from United Way of Broome County than your full ask, would the program still be able to operate? If yes, what changes could be made to run the program? How much funding must the program receive from United Way of Broome County to operate at all, even at a reduced capacity? And please provide a specific dollar amount. So here we want a tangible, qualification of the impact of not receiving the full funding request. So if we cannot fund your full request, would a lesser amount of funding be acceptable? Will that still work to run the program? And do you have the flexibility to scale the program based on the support we can provide? 12 is such an important question because, like I said, we always have more in asks than we have to give out. And this leads to, as many organizations know, often we give out awards that are not at that full ask. So if we don't have this number of, like, what do we realistically need to support this program, then we're sort of guessing how much we need to put towards that program to support it. So by eliminating that guesswork, we can help better, support everyone involved. So next we're going to move on to questions 13 and 14, which are the evaluation plan. So this is 10 points under the category of specificity. So 13, what quantity measures and results indicators will be tracked? So here, refer to the end of the RFP, and you'll see that there's a long list for all of the different priority areas of those quantity and results indicators, with the exception of basic needs. So please provide a target number for each and how these indicators will be measured. So again, here you're going to go to page 13 of the RFP and beyond, and you're going to choose a quantity measure where you'll say the number of people to be served, and then a results indicator that will be the percentage of those served where the outcome will be achieved or will achieve the result. So all measures should be relevant to those programs' projected outcomes. So how will you measure these indicators? Be specific, especially for the results indicators. That's very important. And this is when it sort of cuts on the Lindsay and I piece. As we're looking at these numbers, we have to make that judgment of how is this being tracked? How do we fit this into, how does this fit into that collective impact? And we talk a little bit more about 13 on the next slide, I believe. But we'll talk about 14 now. So what data/client feedback will be gathered for program management purposes? How will it be used? So here we're looking to see, is there a program management strategy? What information do you use to improve the program? Is it regularly evaluated? And if you're successful, how would you know? Finally, if adjustments need to be made mid-year, how would you know? This is all goes into that specificity category, and that helps us get a sense of this program, how it operates, how it tracks its results. So on the next slide, we talk about this measurement framework, which is our quantity numbers of how much and then how well is the results indicators. Again, basic needs will only need to do a quantity number. So select at least one quantity measure and one results indicator, and then it has to be under the correct building block of your program. This year, we've had those quantity numbers and percentage results indicators. We've diversified them underneath the different priority areas. So you should be able to find something under that building block for your program. Indicators should not duplicate data. So choose what you think are the best fit indicators. And then if there is some duplication, please be transparent about this. And that's sort of why we have this third bullet point. So we're really looking at quality over quantity. Choose a maximum of three quantity measures and a maximum of 3 results indicators. And just because that's the maximum, we're not expecting that. We're perfectly happy with one of each. But we found that once you have more than 3 of each, it becomes incredibly hard to accurately prevent duplication of data. And frankly, after those first 3, you start to see a drop off in relevancy and impact that those numbers are providing. So next is inclusivity, and we are almost done with the scored points. So, I'd love to say the application goes that quick when you're typing it. However, it doesn't. So question 15, does your organization currently gather demographic information on its clients? If not, are you planning to begin collecting this information in the future? So, we're looking for you to answer what mechanisms are in place to track demographic information. If you're not currently tracking it, can you understand why that data would be important for the program? And as you know, from looking through these long-term outcomes, we're really using data to try to evaluate our own funding strategies. So this piece is very important. Question 16, how does the organization ensure clients' voices are meaningfully represented? So are there formal mechanisms in place, either qualitative or quantitative, for your organization to gather and incorporate this feedback? Are you responsive to your clients' stated needs? And then 17, how are your clients' population demographics represented among your board, staff, and or volunteers? So do people with lived experiences participate amongst your board, your staff, your volunteers? And not only are they there, but do they have influence? So do the people who've lived through the issues, do they have a say in help promoting the solutions? So finally, we have our program budget, which isn't a question, it's just a submission. And this is up to 5 points on the application for specificity. So here, provide an accurate, detailed program budget, and this is required of all applicants. Use the budget that is in the template available. That link can be found on our request for proposal. And please ensure that the template is completed in full before submission. You don't have to have something on every line item, but make sure that if you're planning on putting money on a line item, you have that line item filled out. Programs applying must detail other planned funding, secured or otherwise. So that's, where are those additional supports to the program coming that aren't coming from us? So again, use the United Way of Broome County template. This allows us to fairly and accurately put things into our system, as well as, grade if every single template is the same. So we're looking to see, do the costs assigned to the grant make sense given the nature of the program? Will the proposed allocation of resources allow you to achieve the goals of the program? And what other sources of funding are supporting the program? So, as you know, with United Way of Broome County funding, we will support any cost for the program, including overhead costs. So here we're looking that you include a justification for those overhead costs assigned to the grant. So if you're writing your executive director's salary into the program, that is fine, but make sure that you're explaining why is 5% of the ED's salary going towards this program? What are they doing for the program? And then if you are interested in applying for multi-year funding, you need to provide us 2 years of budgets. So that's on the template, you'll have that option to write 2 years of program budgets. And you need to do that to be eligible. If we get a submission that does not have those 2 years, then we will assume they are not applying for multi-year funding. So here's an example of that 1 year of program funding. And here's on the second most column, United Way of Broome County funding. There are line items, then you have outside funding, and then organizational contribution. And you put their items for each part of the program, and then you add it up. And if this was a multi-year template, then you would just see this with the same 3 columns repeated, but for year 2. All right, so that was all the questions. And again, if in a month you're reading through them and they're not making too much sense, feel free to reach out. So let's go on to the next slide of attachments. So one of the attachments we need is going to be a financial statement. So all these attachments are used by our partner accountability committee, and it helps determine partners' reporting schedule. This is our responsibility as stewards of donor dollars to make sure that we are, accurately working with programs to see where its funding is going and make sure it's going to the right places correctly. So for financial statements, we have a stepped list of what you need to provide based on your organization's budget, and you can see that right there. So $250,000 or less than $250,000, we need an internally reviewed financial statement signed by a board representative. Between $250,000 and $750,000, we're looking for an independent CPA's review report and financial statements. And then for above $750,000, we're looking for an independent CPA's audit report and financial statements with a management letter. So some more attachments. So all materials, reading the wrong line there. So the agency budget, we are going to ask for 3 years of agency budgets. This is the prior year, the current year that you're operating in, and the future year. So this helps the partner accountability get a sense of program growth, how program expenses and projections have actually matched up. And we don't care if that's from January to December or July to June, as long as we have 3 years of budgets. It's not uncommon for there to be a new organization that's applying without 3 years of budgets. And again, these are agency budgets, so much greater than the program for the entire agency. If you're a new program that doesn't, a new agency that doesn't have the 3 years of budgets, then what we ask is you provide your current budget and then your future budget. So just give us as much material as we can get so we can accurately bring this to the Partner Accountability Committee.
Tim, can I just jump in again?
Please do.
Just some clarification for folks who are running a January to December fiscal year. We absolutely understand that if you're submitting an application in January 24, you are not going to have even an inkling of a 2025 January to December budget. So we do not expect those folks to submit a future year budget. But again, really looking for 3 years. So essentially you would be submitting 2 prior year budgets for 2023 and 2022, as well as your new budget for the 2024 year.
Thank you very much, Lindsay. And here's a sample budget. So your budget doesn't need to look like this, but here you'll see that we have the current year budget and we have our budget on last side and then our actuals on the right side. Then it's broken up by income, expense, etc. And for these, again, what's really important is we have those 3 years of budgets. We're not looking for you to do an overall of your agency's accounting. We understand we're already asking for a lot. We don't want more here besides those 3 years. So some other attachments will need proof of tax exempt status, so an IRS determination letter or Form 990, and we'll also need a board list. So you have to use the template on our website. It's easy to find in the RFP, and we also have it linked here. So next steps. Before we do, I think there were a few questions in chat. I see, first, there was a question I got a while ago that asked about what we consider North and East Side Binghamton for the HLC area. Lindsay, do you? Oh, sorry.
Can you say that one more time, Tim? Sorry, I was reading the other questions.
Yeah, it was a private question I got asking what the North and East Side area were, or what the HLC catchment area was. So
it is census tract. Is it 4, 5, and 6?
4, 5, and 6.
In City of Binghamton?
Yep, in the City of Binghamton.
Yeah.
Thanks, Paula.
Then I think looks like we had one question answered from Kat. Is there a preferred citation style for data information? No, just as long as we can accurately see where that's coming from. Funding limit. So we do not have a set maximum you can apply for. On average, organizations receive between $20,000 and $30,000. Does that sound correct, Lindsay?
Yes. Again, that is the mean average of
Yep.
grants. That can vary pretty wildly. So I would say the smallest grant we give out is about $5,000 all the way up to about $100,000. So it's really about right size for the program. We would like to see a diversity of funding streams if it is a bigger program. So you're not just relying on us to fund, $100,000 program. So it's about that right size piece. But I think, again, for the most part, most folks are getting between $20,000 and $30,000 for a program.
Yep. And then one question from Tajuka, is the requirement the same for a 2-year application? Not sure what you're referencing. I'm going to assume yes. And then there's a question from Cynthia, and that's a great idea, Cynthia. I think that's something that I'll talk with Lindsay and Paul about later. But, well, thank you, Lindsay. You already answered it. Let's move on to next steps. So Next steps
There's actually one, I probably missed this. You just talked about it. Did you read the one from Cynthia?
from Cynthia. Yep. The
All right.
Yep. So next steps. So make sure you fill out the LOI by the 1st of December. So you've already done the most important part of this, which is attend this meeting. If you have any questions while you're doing it, feel free to reach out, and you can find it linked here. 2, after you fill out this LOI, you will be given access to the application by email. The application exists on our website. This year, we're doing things a bit differently. So we're really hoping that with this LOI, we're going to be able to push people into the right direction if they're not there, especially since we've changed this RFP measurement a bit. And every year we get more applications. So we want this to we want it to be easier on all those involved. So what this means is everyone will be given access to the application at the same time, and this probably won't occur until mid-December. However, we are not going to tell anyone they cannot apply unless they don't meet that 501c3 status or they're not sponsored by a 501c3. Obviously, that's a hard rule. However, we're not going to tell anyone they can't apply. So I would really recommend you all have access to the questions, start working on them as soon as you have these program-specific details in place, because it really is just transferring over those answers into the application on the website. If needed, schedule an appointment for office hours, so you can use that link there. And that will schedule a 20-minute appointment with Lindsay and I, where we'll answer any questions you have. And if there's a time that it shows up that does not work for you, feel free to shoot me an email as well. We'll find a time. And then the application will be due by January 26th. Next, we also have a fun networking event at the Beer Tree from 5 to 7 at the factory downtown. Completely free. We are providing food, just not alcohol. Please stop by. There are a lot of different organizations from the community who are coming by, and it's a nice opportunity to just relax with other people trying to make a difference in Broome County.
It's the factory in Johnson City, right? I'm sorry. Okay.
Yes. Yep. And then team trivia, that will be happening next Friday, November 17th. This will be supporting United Way's Mission United program. And Mission United supports veterans and their families and the programs that are supporting those groups in Broome County. Don't get your hopes up about winning, because I'll be playing and I have a crack team already, but I would recommend coming by. It's going to be a really good time. And that's it. Thank you so much for attending. Thank you, Lindsay, for putting so much of this presentation together. Thank you, Paula, for all the help you've given. And if you have any questions, please use my email or phone number to reach out. And like I said, if you don't get this recording from me within the next week, reach out, because I've typed in someone's email incorrectly. Anything else, Lindsay?
I was just going to say, I think we've got a couple minutes. So if anybody had any outstanding questions that they feel like they want to ask in front of everyone, they're welcome to ask those questions. We'll be here for a couple minutes, but again, feel free to pop off otherwise.
I have a question, but do I need to type it in?
No, you can say it out loud. That's perfect.
Okay. So my organization doesn't have a 501c3 status, but we are looking for a sponsor. When we find one, I'm hopeful, and we need to do the budget. Is the budget based on, like, do we need to include their organization's budget, or is it our organization's budget? Like, how does that work?
So, I guess it would depend who the fiscal sponsor was. So if it was an organization that we work with, we don't need to see their budget again, because we would already have access to it. So we would definitely want to see your budget. And then we might want to see their budget. It would just depend who the fiscal sponsor was. And that's something that, again, if we haven't had a lot of applications apply, again, under the fiscal sponsorship of a 501c3, but if you applied and we needed something additional for you after that deadline, we would reach back out to you for that. So, it's a little bit of an exceptional situation. Any other questions? Again, we've got the fire alarm going off across the street. Right, I'm
There's
gonna
a
take-
quick question about the funding limit again, Lindsay.
Oh, yep, we can answer that again. Again, there's no hard cutoff for funding in terms of a limit. The range we give within is very, very varied. So everything from $5,000 grants to $100,000 grants. The average grant we give out is somewhere between $20,000 and $30,000. So if you were a first-time applicant, I would not recommend going above that. However, it really has to do with the size of your organization. We want to see, again, especially if we're giving a bigger grant to you, we want to see diversity of revenue streams supporting that effort from other places. So it's not just our funding. So again, it really depends. We'd be happy to chat with you about that if you have any specific questions for your program. So you can reach out to Tim about that if you would like. We'll connect offline.
I have a question. When I do a budget, if I've written a grant proposal for a program, but I won't know by December whether or not that's going to be included in my next year's budget, what would be the steps?
So that would be for the program budget, that would be in that other funding column. And what you would do is when you submit the full application at the end of January, if it's still like that decision is still outstanding, just put that in the narrative section of the budget. So the budget template has a little box at the bottom where you can explain every single line item.
Okay.
So it's just helpful for us to know, like, okay, we're waiting to hear on this. So we
Yes.
know it's possible, but not guaranteed.
Yes, thank you. Have a good day, all.
Thank
too,
you.
Cynthia.
Bye, Cynthia. Any other questions before we hop off? Again, Tim is available to answer anything offline if you don't want to ask in front of everyone.
Yeah.
Also, go ahead, Tim.
Oh, sometimes I answer questions in my dreams. So, it's anytime.
All right, I'm going to take the quiet as a no. I want to thank you for coming and sitting through all of that content. Again, we know this walkthrough this year was pretty lengthy, but we felt like we wanted to make sure everybody was on the same page in terms of the information and the expectations for this coming year. Again, Tim is a great resource. If you have any questions, we're also happy to see y'all at those office hours in December if you want to dive into something a little bit deeper with us. And hopefully I will see most of you at Your Tree Factory in just a couple of hours.
Bye, everybody.
Bye, everyone.